Morning once again. I'm Charles Mangani, and I'll present on the first project that is looking at malaria epidemiology and vector biology. A brief background to the project. From the ICMA 1, as Don has highlighted, one of the key questions that the ICMA 1 tried to address or to answer was the epidemiology of malaria infection in the Malarian population. So from a number of cross-sectional studies that were conducted over a period of 3 years, it stratified the risk of disease, but also looked at the use of the key intervention for malaria control at that time, which was the bed nets. So I just want to bring your attention to the green, which is prevalence of malaria in school-age children. In the board, in the continuous line, and in the dashed line, it's looking at use of bed nets. So basically, from the ICMA 1 studies, it was observed that prevalence of malaria was higher in the school-age children between the ages of 6 to 15 years, while they also had a relatively lower use of bed nets. A subsequent study to that looked at the type of infection that is common in these school-age children. So it looked at submicroscopic infection, which is highlighted in the graph on my left, and also infection that were detected using microscopy. And what was observed was that apart from having a higher risk of infection, school-age children also were observed to have a higher risk of asymptomatic infections. In addition to observation that was made earlier that they use bed nets less than under 5 children and adults, this study also highlighted that these school-age children also had less use of malaria treatment, especially using formal sources of treatment like health clinics, and often tend to use unreliable treatment from sources that are like shops, so over-the-counter prescription, basically. The second observation that came out from the first ICMA studies was the progression in increase in insecticide resistance in the malaria vectors over the period of implementation of the ICMA studies. And this data from a number of ICMA sites showed that most of the mosquito vectors have developed resistance to the most common insecticides that were being used in the bed nets, and these had worsened over the follow-up time. So based on these findings, the ICMA 2 project, specifically for ICMA 1, was interested to look at what is the long-term effectiveness of bed nets against malaria infection and disease, and secondly, how does the developing insecticide resistance affect the disease prevalence and also Plasmodium infection? And lastly, is there any change in biting behavior of the principal vectors, and how is that related to Plasmodium infection and malaria disease? So to address the first question, we recruited a cohort of children from 2 sites, And from one of these sites, as Don has highlighted, it was the National Malaria Control Program in Malawi piloted PBO nets in the national 2018 distribution campaign. So in one of these sites, Antaja, they had the PBO nets, and in one of the sites, Namanolo, they had the conventional bed nets. At the time of our study recruitment, the nets had been in the households for about 6 months. And we followed up this cohort we planned to follow it up for 1 year, but because of COVID outbreak, we had to suspend our follow-up after about 9 to 10 months for some of these participants. So we followed up the cohort when the nets were from 6 months to about 1.5 years post-distribution. After the end of the first cohort, one of our sites had IRS implemented, the site where they had conventional bed nets, so they stopped. The plan from that site from that year was to stop distributing bed nets and instead put in place annual IRS application. So because of that, when we re-engaged the cohort, we excluded cohort follow-up in that site, and we only concentrated in where the PBO bed nets were deployed, and we had a short follow-up of about 4 months. And basically, the idea was to follow the bed nets up to the end of their lifespan. The policy then in Malawi was to distribute bed nets nationally every 3 years. So we recruited about 1,900 children, and at individual level, we collected data on Plasmodium infection monthly using PCRs, malaria disease using passive case detection, and also we evaluated bed net usage every month. We also collected data on household variables. So, for example, how many bed nets the household had, socioeconomic factors. We also evaluated 25% of the bed nets from these households, looking at their physical integrity. And also we collected mosquitoes from the same 25% of the households. And from a further 16 households, we had human landing catches done. We also collected adult and larval mosquito from the sites. So just highlight a few things in terms of our current findings, and data analysis still ongoing, especially the more detailed analysis. So in terms of the characteristics, basically there were not much of a difference in terms of the numbers of participants, also their age distribution. Looking at the association between bed net type and the risk of malaria disease, and so this is only capturing passive case detective data. There was a slight reduction of about 9% in the risk of clinical malaria in participants who were from an area where PBO bed nets were distributed. So on the next steps on that aim is to analyze the infection data, which is still outstanding in terms of lab analysis for all the samples, and also do more detailed statistical analysis on that. On the second aim, which looked at insecticide resistance, we collected data using WHO cone bioassays. We used two different types of methods. The first one looked at mosquitoes that were hatched from larvae that was collected from the sites. And the second procedure, we used the Kisumu strain of Anopheles gambi, and that was exposed to bed nets collected from a number of households from the two sites. And we evaluated the knockdown rates at 1 hour and 24 hours. So from the first analysis, basically, it showed high resistance, especially of perimethrines and detamethrin, and a high mortality associated with newer compounds, chloralethrin, and in the two sites. In terms of looking at the different bed net types that were in the community, first from the Ntaja site where we had PBO bed nets distributed. Just to highlight that when this was being done, this was about 2.5 years post nationwide campaign distribution of bed nets. So most of the nets then, the mean age of the nets was 2 years, but they ranged from about 6 months to 3 years. So some of the nets were quite new, and mainly from the routine antenatal care and under 5 clinic distribution. So most of the looking at both the 1 hour and 24-hour knockdown rates, most of these from the different types of bed nets showed that mortality was less than 80%. 2 of these nets are PBO bed nets, Olicet Plus and Permanent 3.0, that were distributed through the campaign and also through the routine under 5 and antenatal care. In Namano, where they had conventional bed nets distributed, the results were worse off, and all the nets that were collected from these households were there were no PBO nets from any of the households that we evaluated. The second aim, looking at the biting behavior and also the atrophilic tendencies of the principal Anopheles vectors from the two sites. We, as I said, did human landing catches. We collected data twice during the dry season and during the rainy season. Dry season was in September to December 2020, and the rainy season of January to April of 2021. As I said, in one of the sites, they introduced IRS, that has been highlighted in the 2 graphs. First, looking at the graph on the left is highlighting the general absolute numbers of Anopheles gambi collected from the 2 sites, and the one on the left, my right, is the Anopheles fenestas. So basically, key things from these 2 is that gambi largely exhibited outdoor biting, while fenestas was indoor biting. But what we observed was that after IRS was introduced in one of the sites, there was a slight shift in the biting behavior of the fenestas for about 2 months, then it gradually reversed to predominantly being indoor biting again. We also looked at the relative abundance of the these 2 different types of mosquitoes from the 2 sites. So looking at the site from the PBO nets and the site where originally it had conventional bed nets, but now had IRS introduced while we are doing the our data collection. There was a relative abundance of both vectors in both sites, more in Namano during the dry season compared to Ntaja, where the PBO nets were. And also, as we progress from the dry to the rainy season, Anopheles fenestas was progressively replaced by Anopheles gambi. But that also, we observed a reversal towards the end of the rainy season, which was the month of April. So right now, the next steps are analysis, more detailed analysis of these findings, and also relating them to the Plasmodium infection and PCD data. Thank you.